Hi everybody, Dr. Dawn April Ross of the Thought Word Academy, but today just coming to you as a woman trying to get pregnant. So I just wanted to share something with you. I just recently had an embryo transfer. This is our attempt at making a sibling for my daughter. And I wanted to mention that I have a retroverted uterus, so it's a uterus that tilts backwards. And there was some challenge with placing the embryo in the uterus. Now normally it's very quick, you don't really feel much of anything outside of, you have a full bladder, they put the speculum in, then they put in the catheter and then is done. So but there was some challenge. I also had a C-section with my daughter, so there was like a challenge kind of getting through there and around, and I had an extremely full bladder. So one of the things that the doctor who had done the transfer with me said is that generally what he does is he tells women who have this retroverted uterus to not have a full bladder or to have a partially full bladder, because many times it's easier to see and it's easier to get to it when you don't have that. So it's something that if you do know that you have this, which I'm sure if you've had enough ultrasounds done at this point, which I'm sure you have, or you're in the process of getting ready to, then someone along the lines is going to tell you that you have this retroverted uterus. So just mention it, let people know, because I can tell you that what happened with me as we tried, it was very uncomfortable. They were having a hard time getting the catheter in there. They said, you know what, get up, try to release some, which is like, how do you just pee a little when you have to pee more than you've ever had to pee in your life? I got up, I peed a little, came back, they tried again. Still was not happening. He went and he got a different size or shape catheter. We tried again. Still having a challenge. I said, okay, get up, go pee again. I got up and I peed. I was waiting for them to come back, and I said, you know what, I think I'm going to pee even more. I got up and I peed again, and I came back and I still had a ton of pee in my bladder because it was so overfull. And they tried for a third time, and he said, you know what, I was so uncomfortable. I'm not going to say I was in pain, but I was really uncomfortable. And then I did start to feel some pain, and he said, you know what, this shouldn't be like this. This is not how it's going to go. We're going to start over. He said, just go completely empty out your bladder, come back, and let's try again. So I went, had the best pee of my life. I could have sat there forever, and just really just came back, felt relaxed, felt comfortable, laid down, and they started the ultrasound looking, or sonogram, I forget which one it is when it's on your belly. Anyway, and they looked, and he's like, you know what, perfect, everything looks good, we can do this now. And it was like that, like it usually has been, just in a minute it was done. So just to help maybe avoid for someone else going through some of that pain and struggle that I went through, which is not a normal transfer. If you do have that, if you do know that your uterus is retroverted, then make it known that people, they're obviously going to see that, when they look, they're going to know that. But ask if they're suggesting that you should have a completely full bladder or a partial bladder, just throwing it out there, because sometimes they're just going based on a protocol, meaning like the nurses before you actually get into the transfer room, and it may not be the right protocol for you. So anyway, that's what happened. I just wanted to share with everybody that we are now at 3 days post-transfer with a 3-day embryo. So I am doing, just as a quick mention as well, I am doing HCG boosters. So if I took a test now, it would come out positive, but I can continue to take tests maybe in a little bit and see if that line comes out darker. So that's what's happening, and I wanted to share that information. I hope it's helpful, and if you have any questions or concerns, or you want to speak with a counselor who does specialize in IVF support, please feel free to reach out here. On YouTube, I can go to my website, which I'll put down below, or you can call me directly anytime, and I'm happy to help in any way I can. So sending you all very sticky baby wishes, and hoping to hear good positive news soon, and hoping to share some positive news with you all as well. Take care, be well.